really, I think our comfort level with silence is so important in
Wow.
any kind of counseling. One of the things that we do with our students, or I do with my students at HDS, is when we're practicing counseling in dyads or triads, is to see how you experience not responding. What comes up for you when the prompt is listen to your partner talking about something difficult and don't say anything back, but rather respond with a loving presence. Just be present and receptive with an open heart. And so many people are uncomfortable without indicating their understanding of the person. I'm a chronic nodder, so I'm constantly like, you see me on here as you're talking, I'm like nodding. I'm wanting you to know that I'm getting it and I'm attuned. And yet being mindful listener also can mean just simply being still and receptive and not having to fill the space when the person stops talking. In fact, in some cases, if you allow or encourage that silence, but you're really still with the person and present with them, there may be an uncovering of even deeper content. There's a space there for them to sort of peel the layers away a little more for them to process. But if we're always filling that space, there's no chance for that to happen. So silence is extremely important in listening. Um, and especially when we're feeling helpless with how to respond. I'll give you an example. There was a young woman, she was 24 when I was at Dana-Farber and had been diagnosed with acute leukemia. She had 2 weeks to live without treatment and was a Buddhist practitioner. And so she asked the nurse, she said, is there a Buddhist chaplain here at the hospital? And they said, yes, we have one. And they called me. And funny side note, she said, oh, is he Tibetan? And they said, no. She said, I don't want to see him. Anyway, the nurse convinced her, well, why don't you just let him drop by and talk to you? And that kind of began a really lovely sort of chaplain patient relationship for the whole year that she was at Dana-Farber and Brigham and Women's in treatment. Um, she actually, so this was in 2007. She has now been cancer free for close to however long that is, 10 plus years or more. Has been a journalist, got married, lives in the UK now, and really is thriving. So that's the end, the continuance of the story. But back then, she was really done. Her body had been beaten up with full body radiation, bone marrow transplant, isolation. Um, I went through this whole process with her, along the way. And one day, she said, I really need to talk to you. She came into the hospital. And so I booked a consult space and we went in. And this person who was usually so resilient and positive and energetic was just utterly defeated by everything. She was weak. She was in tears. And she walked into the room and said, Chris, what do you tell someone like me? Usually I have a lot to say about a lot of things. I had nothing to say. And we sat down. All I could do was sit in the silence and just hold this loving space for the helplessness that both of us were feeling in that moment. Um, I had nothing to say. Anything I said would have been ridiculous, or it would have been a platitude or something to fill that space. But instead, it was important for me not to say anything. And what I did do was I practiced a form of Tonglen, which is, we've done that here before, um, radiating my heart, breathing in just the suffering, the helplessness, and then exchanging that with this sort of luminous, bright quality of compassion and love. And that's all I could do in that moment. And she didn't know what I was doing. Um, but for me, that was the response. And it wasn't to look away or to be uncomfortable or to kind of try to get away from the suffering. Rather, it was to lean into it without words. Um, that silence was essential.
Mm.
And so were the tears in that silence. So you see, there are variations on that. There's a continuum there of how much silence, how often. Of course, we don't want a client to be uncomfortable if we're staring at them and they're like, what do you think? you know, um, then maybe we respond, and it's okay to be honest and say, I don't know. It's okay to be transparent with not knowing, as a therapist, as a counselor, as a chaplain. Um,
Mm.
so I don't know if that answers, Andrew, if that answers kind of the question, but silence is so important and it's sacred. Otherwise, we end up projecting ourselves into that space between, when in fact we want to begin with the default of being fully receptive and to move with someone wherever they're going. We move with them,
Mhm.
you know.